The Heart Attack Prevention Program is a comprehensive heart check by a specialist or an experienced preventative cardiologist. During that assessment, you will have a history taken by the cardiologist. So he or she will want to know all of your risk factors and go into that discussion in quite some detail. You will have a physical examination by the doctor to check a number of different things from the cardiovascular point of view, and then more than likely you will need some testing. The testing that is done is fairly straightforward and painless. In many cases it will involve a resting echocardiogram. This is an ultrasound test which involves no radiation, and the technology now is amazing so that we can actually see your heart and use what's called Doppler to track the blood flow through your heart, to check out the valves, to check out the muscle, and basically to measure other things lying around the heart with their measurements such as the aorta. So this is a very helpful test in seeing how your heart is and whether things such as blood pressure, if high, may have affected it. Patients who have a high calcium score will generally be recommended to have what's called a stress echocardiogram. Now this is an exercise stress test on a treadmill where the doctor and technical staff will be supervising this for you. Your ECG, or the heart's electrical cardiogram, will be monitored throughout. And by watching the ECG, but more importantly the echocardiogram, which is an ultrasound representation of your left ventricle pumping before and after the test, we are able to see effectively what your coronary blood flow is and whether the plaque that may be in your coronary arteries is obstructing the blood flow, which would be normal. In addition, we get quite helpful information during the stress echo telling us about your heart rhythm stability and your heart rate and fitness. And also occasionally we will find that a patient might develop symptoms on the treadmill when prior to that study we weren't really aware that they had any. So a stress echocardiogram is a very important test. They would be the main tests done during a heart attack prevention program, although there may be others. Patients with high blood pressure, for example, may have specific monitors recommended. Patients who are picked up as having heart rhythm disorders may have other monitors also. And perhaps in individual cases there could be some other blood testing or even some other imaging tests recommended. At the end of that assessment, you will have a very, very thorough knowledge of your heart and particularly what the plaque results may have meant for you in your individual case. The cardiologist attending you will give you a personalised management plan. This will include lifestyle measures in terms of your diet, exercise, stress reduction, trying to get you to have a better balance in life, things to improve your sleep, and a whole host of things which will basically contribute to your general health and wellness. And in some cases, certainly there will be recommendation for certain medication, possibly aimed at your cholesterol, your blood pressure, or to thin the blood. Your GP will receive a report on the results and the recommendations and any follow-up that is required.